Since it's Breast Cancer Awareness Month, let's talk about breast cancer, risk factors, and treatments. Breast cancer is the cancer of the breast tissue. But what causes breast cancer? Cancer could develop in any of your cells, but there are some factors that increase your risk of developing a breast cancer. A research divided risk factors into two categories: factors that can be modified and factors that cannot be modified. Let's talk about modifiable factors first. How physically active are you? If you're overweight or obese? If you regularly consume alcohol or smoke? What your vitamin intake is? Consumption of processed foods? Or being exposed to carcinogenic chemicals? These factors increase your risk of cancer, but it does not necessarily mean that you will end up having cancer. Let's talk about non-modifiable factors. If you're a female, if you're older, if you have family history of breast or ovarian cancer, what your ethnicity is, if you're pregnant or breastfeeding, if you're undergoing menopause or menstruation, if you have a history of breast cancer, if you have had pre-existing breast diseases, or if you have undergone any previous radiation therapy. Again, these factors increase your risk of cancer. It does not mean you will necessarily end up having cancer. Breast cancer can be benign or malignant. Benign meaning it can be localized, or malignant meaning it is capable of spreading from one part to the other. So what is the treatment of breast cancer scenario like? First one is surgery. The first kind of surgery is breast conservation surgery, which is the removal of cancer cells from breast. The second kind of surgery is mastectomy, which is the removal of breast completely, which is immediately followed by breast reconstruction. The second one is chemotherapy. Chemotherapy has proved to be very effective but has many side effects like hair loss, nausea, fatigue, increased risk of infections, etc. Third one is radiation. Radiation is used to give local treatment to affected areas. It is usually given after surgery or chemotherapy. It is also used to minimize recurrence of breast cancer. The fourth one is hormonal therapy. It is effective if breast cancer recurs or if the cancer is metastatic. The therapy either lowers the estrogen levels or blocks estrogen receptors on breast cancer cells. Fifth one is biological or targeted therapy. This treatment is used at any or all stages of breast cancer. It is used to block an abnormal protein called HER2 that is known to stimulate breast cancer, often used in combination with chemotherapy. Stay aware, stay healthy, and stay safe. That's all for now. Bye.